Okay, Salam alaikum. Good evening, ladies and gentlemen, and thanks very much to Dr. Muhammad Hassanein and the team for inviting us to share in this program. I'm presenting on thyroxine replacement therapy during Ramadan from a different angle, i.e. physicians and patients' perceptions and practices on behalf of the group that includes Ali Khalil, my son, Anas Beshya, Mahmoud bin Barka, and Ibrahim Sharif. Okay, these are our disclosures. None, no conflicts of interest, and research and authorship ethics has been observed, and there is no funding required for this study. So I think after the excellent presentation by the co-chairman and the Reem on the subject, I will only use this and the following slide to just sum up our direct motive for doing this study. We have been shown very nicely that several studies demonstrated that the optimal and consistent thyroxine absorption occurs under fasting conditions. However, non-fasting conditions has been shown to be critically suboptimal for a higher and variable serum TSH concentrations. On a different angle, there are other workers who've shown that the evening dose can actually be adequately or equally good or effective in lowering the TSH compared with the morning dose. And I think this is in general outside the Ramadan fasting. So what's the rationale for looking at this? Patients, as Reem has mentioned, may find it really challenging to take thyroxine on an empty stomach, since the first evening meal is, particularly in our part of the world, is commonly associated with a family gathering and other social activities. Therefore, ascertaining the patient's practices is of paramount importance. Also, several recommendations exist. The older recommendations were based on translation from non-fasting situations, non-Ramadan situations, and recent studies has actually used data from Ramadan, and they are still conflicting. I think we've just heard unpublished data from Reem just now. And therefore, knowing the patient's perspective and practice is very important too. So the design we've done is a mixed method study. We included our survey monkey to have an assessment of physicians' perceptions and practices using an online survey. And for the patients, we used a structured interview. And I'll illustrate this in more. Did you hear me up to date? Because the organizers...
Yes. Yeah, we could hear you. Please carry on.
Okay, you could, fine, okay. So the objectives regarding the physician's component to examine the physician's perception regarding the clinical relevance. Firstly, do they believe that it's relevant or not? And what they do? Do they give any advice? And what advice they give? And do they monitor or not? From the patient's component, we actually simply ask them, what do they do? And what is the source of their knowledge and how they came to this practice? So the analysis of the data was based on descriptive analysis of the two parts of the study separately. And also we used the timing, which is the most crucial part of the study, that actually was asked to both patients and physicians to make a comparison with them using a chi-square test. So the physicians survey was a sample of 218 physicians from our email database, and we've asked them about their professional profile, what they perceive of the relevance of Ramadan fasting on thyroxine replacement therapy, and do they give any advice, and what advice they give. And also ask them specifically, do they monitor or not monitor? For the patients, it was a convenient sample of consecutive patients that were seen by a single clinician in a clinic with multiple practitioners. So anybody who came to that single clinician, whether they are his own list or not, for any type of clinical encounter, were asked if they are on thyroxine, say, we're asking, making this questionnaire, do you mind if you participate? They consented, and that was 100%. Then we asked them specific questions related to the pattern of their thyroxine intake and who advised them to do that. The physicians were 218, as I just mentioned. There are more than half of them are senior physicians, and just under half represented endocrinology. So these are the questions, first slide of the questions to the physicians. Do they believe that there is an impact of Ramadan fasting on thyroxine replacement? And just over half said it is not clinically relevant in most patients of thyroxine replacements. So they did not believe that it is relevant. Just over a quarter, they say the Ramadan fasting affects thyroxine replacement therapy in a clinically relevant manner. So just over a quarter. And then between 6.7 to 13.3%, they either have no clue, they did not know or not sure, or they did not feel strongly on either side of the first or second choices. Now, the second question, do you advise the patients about the way they take? And actually, 77.1%, more than 3/4, said yes, they do advise their patients. So those who said they advise, we asked them specifically, what advice do you give? And 52.4% said we tell them to take it at any time they wish, but to ensure no food is taken before it for 2 hours and 1 hour after, i.e. around the Tarawih time or at bedtime. And just less than 30% said I advise patients to take thyroxine with suhoor and delay the suhoor by 30 to 60 minutes. And 18.3% said I advise patients to take thyroxine at iftar time and delay iftar for 30 to 60 minutes. When we ask them, do you actually monitor the thyroid functions after Ramadan for patients with thyroxine who are coming for follow-up specifically for after Ramadan? And actually is nearly 3/4, they said no, unless it is indicated for another reason. And just over a quarter said, I do it routinely. For the patients survey, we included 172 patients. There are obviously more women than men, and a median age was 46 years. The duration, median duration, 5 years. And the last change of thyroxine report is around 6 months. And the current dose was around 100 micrograms. This is a median dose, 100 micrograms a day. And we asked them, what is the source of advice on which you're taking this medication in the manner you described? And they said, from the doctors, by half, about over 40% said we have not had any formal advice. And surprisingly, the only 2.3% asked their pharmacists, which is a strange observation. Now, when we asked them about the timing, nearly 60% said they take it with iftar, and just under a quarter they take it with suhoor, and about 16.3% is around 1 in 7. They take it at other times. And the time allowed before and after was quite wide, but it is reasonable overall. Now, this is the most interesting finding, that actually when we pulled the patient's survey and the physician survey together, this common question about the timing came up, and there was statistically significant discordance between the advice most physicians give and the patient's own practices in the time of the thyroxine. As I've already shown, most physicians advise at any time, provided the thyroxine food gap is maintained, and most patients seem to take their thyroxine with iftar. This is an important finding, therefore we are showing it in a graphical manner here. You can see the statistical significance is very high between in the advice of the physicians against the practice of the patients. The limitations of the study must be admitted. The physician sample is small. I think I have done so many SurveyMonkey studies that my colleagues stopped responding to them. Also, there are limitations inherently in any survey, because simply you ask questions and people respond. The response may not be truly a reflection of what they do in clinical practice. The patients, it is a single clinic. There may be a recall bias. If they have had hypothyroidism for a long time, they may not remember it. And for the measurements, although I did not present that today, there's a wait time up to 12 weeks. And naturally, TSH and T4 taken a routine clinical practice may not be very good reflection of the real situation. So in conclusion, not all physicians think that Ramadan fasting has a clinically meaningful impact. So we need to find more data so that we can convince them or support them that actually what they think is right. Not all doctors give specific advice consistently. There is a great discordance between the advice most physicians give and the patient's own practice in the timing of thyroxine intake. And more consistency, clarity, and evidence base are needed in the advice that need to be given to hypothyroid patients taking thyroxine during Ramadan fasting. And I'm actually delighted. I enjoyed very much the presentation by Dr. Reem with such an excellent planning and implementation of the study. This current study will be fully published in the Journal of Diabetes and Endocrine Practice in the January issue. And I appeal to all of you at my last slide to support regional research and regional journals. Thank you very much.